Sorry about that. I was in the library. Kind of, gotta be quiet. Anyway, you're probably wondering, why are we here? Well, it's to talk about the cath lab. And what exactly is the radiographer's role in the cath lab, you ask? I'm glad you did. Basically, our role is to, one, provide high quality imaging, maintain patient safety, operate C-arm equipment, and support the team in anything it needs during both diagnostic and interventional procedures. So how do we do that? We make sure the patient's anatomy is properly aligned for the optimal imaging. We also assist in preparation and injection of contrast. We typically use iodine contrast inside of a cath lab. We'll talk more about that later when we're at the hospital. We also provide images as needed in real-time decision-making for the cardiologist and the rest of the team. You know, when we're dealing with the heart, you gotta operate fast. Real-time imaging does that. What are these imaging that we need to do? So we do ablations, we do angiograms, we do angioplasties, we do stent placements, and we do more, all while adhering to the safety protocols of the hospital and minimizing radiation exposure. That's the big one. All right, so come with me. So now that we've kind of gotten a gist of what exactly our role is as a radiographer inside the cath lab, next we're gonna dive deeper into the physics as well as what are pre-procedure protocols at most facilities for what we do in that cath lab. Now that we're at the hospital, let's talk contrast. Iodine contrast agents are typically preferred due to their high atomic numbers, making it more effective at absorbing X-rays, which in turn produce clear, higher quality images of the heart and vessels. So, why use contrast? Contrast helps the cardiologist to better visualize coronary arteries, heart chambers, and other crucially important structures during a procedure. Oh, hey, I didn't see you there. You know, since the hospital's pretty big, I kind of thought I lost you. But now that I have you, let's talk physics. Some key concepts that help cardiovascular conditions are X-rays and fluoroscopy radiation for detailed imaging, electrocardiography, which measures the heart's electrical activity, electromagnetic fields, such as but not limited to pacemakers, which send electrical pulses to regulate the heart's rhythms, and Boyle's law, which, when you boil that down, measures pressure and volume within the heart and its blood vessels. Together, these physics principles allow cardiologists and the team to perform diagnostic tests, guide catheter procedures, and ensure the heart is functioning properly during various interventions. Now, I'm going to go ahead and go get changed in my surgical scrubs, and when I come back, we'll get more into the weeds about cath lab. While I'm getting my blues on, that's slang for surgical scrubs, let's talk about the pre-procedure protocols that we do as radiographers inside the cath lab. As I talk, enjoy these 4 more images from inside the lab. In order to establish a smooth, safe, and effective environment, it is essential that we make sure our equipment is warmed up and functioning properly. We prepare the iodine-based contrast, including dose and setup. We verify that the sterile field has been set and is ready for catheterization. We ensure there is enough lead, aprons, goggles, thyroid shields, etc., for the entire team. We verify the patient's name, date of birth, and MRN. And lastly, we review the patient's medical history, especially any potential known drug allergies to contrast medias. Now that we've briefly discussed the ins and outs of radiography in cath, let's review differing radiation exposure in scrub techs and rotating staff in cardiac catheterization laboratories. Occupation matters. Basically, this article hones in on the real-life radiation exposure risk for non-physician staff in the cath lab. It is worth mentioning that the International Commission of Radiological Protection has implemented annual limits to 50 millisieverts for whole-body effective doses for an individual radiographer. This study used Ray-safe I2 dosimeter badges on 9 participants during 46 invasive cardiac procedures in 2021 over a 4-month period. The findings of this study showed that scrub techs were given more protection due to lead shields and stationary rolls, where on the flip side, rotating staff working closely
with patients during combined procedures received over 3 times the radiation exposure than the techs had. Simple awareness and monitoring could reduce exposure. The article recommended providing left-sided lead shields, protective lenses, and modifying staff positioning during procedures. It concludes that further research is needed in order to grasp a better understanding of the impact from real-time radiation exposure and to improve protective practices.
As promised, I'm in my blues now. I hope you've gotten a better understanding over the past few minutes of the Cath lab modality, what exactly our role as radiographers is in it, how fluoroscopy plays a crucial part for visualization of blood vessels, the heart, and catheters, and how we are more than just the button pushers of medicine. We quite literally are the eyes for the doctors. We play a very important role. Don't forget that. Now, keep learning, stay safe, have fun out there, y'all. Why use contrast? Contrast to better visualize our role as a radiographer. Start over. I didn't. You gotta learn. They're here.